This is new at 6. A new high-tech tool is helping local healthcare workers overcome language barriers. It is called Video Remote Interpreting, or VRI. Our Tammy Tremblay reports on the difference the technology is having in rural communities in our area. Take a look.
Hi, I'm Margie.
Mobile health clinics like this one come to rural and agricultural communities where access to health care can be limited or unattainable for some residents.
We see about 70% that are uninsured, and the few that do come in with insurance, just because of the deductibles and the high co-pays and things, are not accessing and utilizing their insurance very well.
Maria Lee is the mobile clinic coordinator for St. Alphonsus. She has been driving this van around Canyon County now for 3 years, unloading supplies and equipment into places like this, a food box distribution location in Caldwell.
We have blood pressures, we're doing blood sugars, we're doing free flu shots, we have ear washing.
There's also dental, vision, and cancer screenings at some clinics. When someone shows up speaking a language unknown to the healthcare providers, Lee says this has been a wonderful tool.
Hola, yo soy América, yo voy a ser su intérprete. ¿Sí me escucha usted?
Hola, sí, yo soy Francisca.
Buenas tardes, señora Francisca.
The Video Remote Interpreting System, or VRI, connects the nurse or doctor with a person at a regional call center who knows the patient's language.
And I'd just like to ask her how she's feeling today.
¿Cómo se siente usted hoy?
Muy bien.
So what this does is provide an in-person interpreter over an encrypted and secure video feed, so that you have real-time interpreting at the touch of a screen.
Tony Fisk is the Community Services Manager at St. Alphonsus. He explains how easy it works.
Basically, there is a touch screen with some icons for the available languages. You can select whether you want a male or a female interpreter, and you simply touch that button and wait for somebody to come online or for an operator to help you.
He says it takes about 2 minutes to connect and speeds up the care of patients at these clinics where there are no appointments.
Have you ever had a flu shot before?
Soy una de las enfermeras.
Spanish has been used most often, but Lee says it's certainly not the only one. There are 200 at their fingertips, including sign language.
Our focus has been the Spanish speakers, but I've had a woman from Mongolia come in speaking Russian.
With VRI technology, the language barrier is no problem, and Lee says they imagine it will only be used more and more across our community.
This tool is just a beautiful example of how we can reach out and touch the patient in their own native tongue, and we can help them to feel comfortable and welcomed and cared for, because we can communicate easily with them through this interpretive tablet.
In Canyon County, Tammy Tremblay.
That's it, you're all finished. Muchas gracias.
Thank you. Thanks a lot.
Idaho's News Channel 7.
That is amazing. All St. Al's clinics and hospitals have the VRI tablets. There are 82 of them. The medical group tells us they have a large pool of in-person interpreters, but as you can imagine, the technology is a great backup.